What we want to focus on in this year's report is one of the areas that we find are key to making progress. We want to focus on inequality. And there is a huge inequality in terms of access of women and girls' access to reproductive health services. And what we document in the report is that in most countries, 20%, well, the lowest quintile of the population does not have access or has very poor access to reproductive health services. So it basically means that in our work, we need to be very focused on reaching the poorest and very often the young and the people living in rural and hard to get areas.
One of the challenges globally is the lack of technologies or solutions to test the quality of medicine. So a mother may get substandard or poor or fake medicine that can really lead to her death or morbidity, tremendous financial loss. One of the focuses that we have is to develop technologies that can test the quality of medicines at all points in the supply chain. We also have other solutions, software and system level solutions to strengthen systems so that hospitals, healthcare providers can optimize resources in an effort to make sure that the dollars or the euros that they spend are sort of really used most efficiently to save the lives of mothers. So my first job is to create awareness, and I think part of my excitement of being here is to really sort of learn from the experts and take these messages to the classroom. My students are far smarter than I am. They're far more engaged, whether it is through social media or social consciousness, they're far more engaged. But unless and until I'm able to sort of connect these dots and bring them these questions, they won't be able to make those changes.
Overall, we do see that the key to making economic progress and narrowing the inequality gap, also the economic inequality gap, is really through providing reproductive health services for women. And we're talking about access to contraceptives, maternal health services, prenatal care, etc. The whole package of reproductive health services are the areas and the key to actually addressing this inequality gap.
I think there's a lot of work that needs to be done, and we don't need to be naive in saying that this is going to happen. I think it's going to take very serious effort, very serious work, and we have to do all that is needed. But my source of optimism actually comes from my classroom, from the people that I interact with, the youngsters who are far more socially conscious, internationally connected, and very acutely aware of the challenges. If I'm able to sort of convince them, if I'm able to sort of energize them, then I think they have brilliant ideas. They recognize that traditional silos are no longer working. They're able to sort of take the chances, go to places, really impact things. I think the responsibility is tremendous in making sure that these people who are going to be in the workforce in 5 or 10 years remain engaged, remain motivated. But if we are able to do that, then I think their inherent capacity to innovate, their inherent capacity to make things happen is something that motivates me every day.